Senators continue to connect the dots on alleged rampant corruption in PhilHealth. But the Presidential Anti-Corruption Commission says it's not just those at the agency's helm who should be held accountable. To tell us more, we have Mean Los Baños. She's reporting live from Mandaluyong City. Mean, how's the Senate hearing shaping up so far?
Charles, more irregularities in PhilHealth were uncovered in today's Senate hearing, and some former officials of the agency confessed to senators that it was corruption that made them give up their position.
Madami na kaming inimbestigahan, kinasuhan, pinatanggal at pinakulong. Pero ang issue ng PhilHealth, grabe po ito. Grabe ang nakawan, grabe ang kakapalan, grabe ang kawalangyaan.
This was how Greco Belgica, commissioner of the Presidential Anti-Corruption Commission, described the supposed anomalies in PhilHealth, with 2 to 3 billion pesos of the agency's weekly transactions exposed to corruption. The PACC official also pointed out flaws in the agency's IT system, making it susceptible to manipulation by employees and hospitals.
Dahil walang validation mechanism, bayad lang ng bayad ang PhilHealth ng parang tanga sa mga ospital habang naman ang tao.
But it's not just PhilHealth President and CEO Ricardo Morales who should be held accountable, according to PACC.
Mula board, executive committee hanggang sa regions, pending investigations at mag-appoint ng mga OACs para sa araw-araw na operation. Mula ulo hanggang paa ang korupsyon sa PhilHealth.
An emotional former PhilHealth Senior Vice President for Operations Augustus De Villa confessed to the Senate the reason behind his resignation. Aside from wanting more time with his family, De Villa said he gave up his position out of delicadeza.
Hindi ako babagay na magsilbi pa sa isang ahensya ng gobyerno na punong-puno ng aligasyon ng korupsyon at kahiwalian.
It was also out of conscience that Etrobal Laborte left his post as Chief Executive Assistant.
Hindi na kaya ng konsensya ko ito, sir. Tapusin ko lang 1-year service, which is sa July, sir, sa PhilHealth. Maraming salamat po. Tapos noong 16, sir, nag-text naman ako sa kanya, sir. Ang sabi ko sa kanya, sir, ito yung sa OFW na naman, sir, na issue. Sabi ko, sir, I can no longer work with these kind of people. So I really need to go.
Meanwhile, PhilHealth SVP for Fund Management Sector Renato Limsiaco cried foul over the allegations that he's part of the so-called PhilHealth mafia.
In a dedicated public servant, exposed my family to ridicule in disrepute, and most importantly, affected my elderly parents. Considering the foregoing, I most respectfully request the Senate to carefully parse the allegations of Mr. Cabalig and Attorney Kit and make them accountable for their reckless action.
In the same hearing, senators grilled PhilHealth over the release of funds worth over 9 billion pesos from March to April. These were issued under the Interim Reimbursement Mechanism, or IRM, despite the lack of clear guidelines on how regional offices will use the funds. Morales insisted that board had adopted a resolution as early as January as part of the COVID response, but senators were not sold.
Who is the president or is the chairman of PhilHealth did not do anything until mid-March. He was even saying that do not panic. And yet an agency under the Department of Health was already panicking, if we are to believe them. So obviously, Mr. President, this is an excuse.
PhilHealth officials also took turns in explaining that the IRM is not only for COVID-19 but for all types of sickness. PhilHealth SVP Rodolfo Del Rosario said if there are doubts of favoritism in terms of releasing funds to hospitals under IRM, they are willing to investigate it.
Region 1, during that date, when that particular document was received.
Charles, Senator Drilon is proposing for a remedial legislation that will give authority to President Duterte to reorganize PhilHealth that will pave the way for the resolution of these corruption issues. Charles?
Thanks, Mean. That was Mean Los Baños reporting live from Mandaluyong. Over 150 criminal complaints were filed before the Office of the Ombudsman against barangay captains said to be involved in the anomalous handling of social amelioration program funds, says Interior Secretary Eduardo Año. 50 of them have been placed under preventive suspension, and Año says that the charges include malversation, corruption, estafa, and other graft-related offenses.
So ito po ay merong 13 sa NCR, 13 sa Region 1, 10 sa Region 2, 3 sa Region 3, at 11 po sa Region 4A, total of 50 barangay captains. Ito po yung initial at ang mga iba pa ay susunod lang po sa patuloy na pag-iimbestiga ng ating ombudsman.
Anyo also said that out of 1,900 applications for cell tower permits, only around 430 remain pending. This as they trimmed the processing of permits to just 16 days from 241 days under the old system. President Duterte said those involved in the delaying of permits will be shown no mercy.
So sa loob po ng susunod na linggo ay babantayan ko itong mga pending na ito. At sisiguraduhin po natin na dapat maaprubahan at kung hindi man, dapat malaman natin dahilan bakit hindi naaprubahan.
Over 300,000 quarantine violators have been apprehended since ECQ was first declared. According to data from the Joint Task Force against COVID-19, more than 308,000 quarantine violators since March 17, almost half were warned, while 25% were fined, and the remaining 28% were actually charged. 23,000 new violations were logged since August 1, the first day of MECQ in Metro Manila and nearby provinces. Most violators were cited for reckless driving, and the other 39% were for disobedience and curfew violations. Joint Task Force Commander Guillermo Eleazar cited these numbers as he lashed out at Filipinos earlier today, saying the public makes it difficult for the government to protect them. Expressways are now looking for ways to help curb the further spread of COVID-19. Cavitex, for one, will go cashless on toll booths starting August 15. Gerard de la Peña with the details.
These modular booths provide more collection points in toll plazas, helping ease congestion, especially during peak hours. But starting Saturday, this will be a thing of the past at the Parañaque Toll Plaza of Cavitex. 5 booths from the northbound and another 5 at the southbound will be removed. The pass-through lanes leading to them will also be converted to cash lanes. This leaves motorists with just 5 cash lanes per direction. Authorities say this is to mitigate the further transmission of COVID-19.
Kailangan natin na gawin ito para suportahan yung purpose or yung direction ng government natin na magiging cashless na ang transaction.
Other expressways are expected to follow suit as the plan is to go 100% cashless by November 3. The NLEX management will phase out the Easy Trip tag device starting September 30 to pave the way for exclusive use of RFID stickers.
So many cars have been lining up for the installation of RFID stickers since the management announced the gradual transition to cashless transactions. Officials say users of the expressway are mostly owners of light vehicles who are savvy enough on digital transactions.
That's why J. Peter, who frequently passes through Cavitex, had an RFID installed in his car.
Mas maganda naman yun. Okay naman.
Bakit po?
Kasi mas mabilis na yun eh. Kaysa mag-cash ka, magsukli, mabagal, matagal. Siyempre, magkakaroon ng contact pa.
The Metro Pacific Tollways Corporation said RFID stickers are free.
It's not that difficult, no? Magpa-install ka na ng sticker, lagay ka ng minimum load, then off you go. So pero sa susunod na nabalik, naka-sticker ka na.
Motorists will just have to pay 500 pesos for initial load, which they can use whenever they pass through the expressways. For News 5, Gerard de la Peña, we are One News.
Let's pause for a quick break. One News Now. We'll be right back.
Individuals to test its safety and efficacy. A Pinoy nurse in UAE volunteered to participate in a vaccine trial in hopes that this vaccine may be available to everyone as soon as possible.
Erickson Pascual has been working as a nurse in Abu Dhabi for 7 years now. When the COVID-19 pandemic struck, he worked at the front lines, taking care of patients infected with the virus. Now, he has volunteered to be part of a vaccine trial in Abu Dhabi.
Just in case, sana ma-approve na siya soon para kung sakali lahat magkaroon ng hope para sa mga tao na magkaroon ng vaccine.
15,000 volunteers of different nationalities residing in UAE will take part in a vaccine trial conducted by Abu Dhabi's health department in partnership with Chinese pharmaceutical group Sinopharm. Erickson and the rest of the volunteers will receive 2 vaccine shots and will be monitored for around 12 months.
5th day ko na ngayon. Tinatawagan ako day by day just to follow up kung meron ako reaction. So far, hindi ako nilagnat. Wala akong nararamdaman sa katawan.
According to the Food and Drug Administration, the vaccine being developed by Sinopharm is just one of the vaccine candidates currently undergoing phase 3 clinical trial. Russia is about to register its locally developed vaccine for the 3rd phase. President Duterte committed to test the shot himself once it arrives in the Philippines. He longs for a COVID-free December in the country as manufacturers look to release approved vaccines by September or October. But that's far-fetched, says a vaccine trial expert, as observation period for a new vaccine takes at least 12 months. Some even take decades, like shots against malaria, dengue, and HIV.
Now you tell me that in 6 months you're gonna have a new vaccine? Kumbaga sa Tagalog, suntok sa buwan.
She also cautioned that the FDA must closely look into each of the vaccine's efficacy rate before it can be mass distributed to Filipinos.
Charles, the FDA earlier mentioned that accepting vaccine trials in the Philippines would help us well-positioned on its global allocation once proven safe and effective. But FDA Director General Eric Domingo insists that any vaccine would have to be registered in the country before it gets to be marketed for Filipinos. Charles?
Thank you, Greg Gregorio, reporting live from Mandaluyong. COVID-19 cases in the Philippines continue to rise. Just today, nearly 3,000 new infections were added. The case tally in the country is now inching towards the 140,000 mark. 19 more people lost the battle to COVID-19 overnight, and that pushes the national death toll to over 2,300. 280 patients, meanwhile, recovered over the past 24 hours, and so far, more than 68,000 have gotten better from the disease. For more updates, follow News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime and anywhere. I'm Charles Lejano. We are One News.
And in this particular case, in regions 8